Okay, so we want to go to the next topic.
Yes.
Which is peptides. Now, peptides are something that is a little bit newer. We hear about them a lot, but sometimes we don't know about what's available, how you use it, and where you get it. And there's so many different questions. And when do you use what, and how?
It's important.
There's so many things that we don't know.
I think for me, as I've gotten into the aesthetic industry, been in it for a while, we're like, okay, we're doing good with the beauty, we're doing good the things, but we do realize that what we supplement, what we provide to the body is actually very important and will actually synergistically make the things that we do better. Collagen stimulation, all of the things that go on with the aging process, and these peptides are there to force some of those things that have started to slow down back into a little bit more functional state. And that's essentially what we're here for. So
I want to introduce to you a good friend of mine. I love her, Kristen Hanenian. She's joining us from Tampa, Florida. And Kristen is a provider that has been in aesthetics for a long time. She's got a clinic there in Tampa. And, if you want to go to somebody in that area that is knowledgeable, that is safe, that is educated, she's your gal. So you don't have to you don't have to look at billboards. You can just go to Kristen.
Hi, Kristen.
Hi, Kristen. Thanks for joining us.
Thanks for having me.
Thank you. So you've been involved in doing peptides and regenerative medicine for a while now. So we talked about this when I was back in Tampa last time, and it was so interesting. But we kind of let our audience know let's start from the beginning, because I'm a baby. I'm a baby at peptides. You know more about than I do. But what are peptides? Kind of just let us in on this whole new thing.
Well, simply put, they're amino acids, right? So anywhere from 2 to about 50 amino acids are going to be what you call peptides. Anything greater than that, then you start moving into proteins. And while they've really received this uptick in popularity, I mean, they date back to 1920 with insulin. So they're really new in our field, but they're not new in general, if that makes sense.
Right. Mm-hmm. For sure.
Yeah.
I mean, that's everything in medicine.
Right.
Yeah,
that's right.
That's everything in medicine. And
that makes sense.
It's trendy. Unfortunately, it's trendiness. I think with the whole push into the health, the regenerative aspect of it, I think that's where this whole push into the peptides are really big into it. And then to tie in, the whole semaglutide, the tirzepatides, all the weight losses are classified actually as medications, but they're actually peptides in and of themselves. And so that's brought a lot more shine and light into the peptide world. And so I think that's where, our time here is to really, really elucidate and give the audience an understanding of peptides and I think what they're here for and what you can use. There's so many, as I'm still scratching the surface myself and trying to learn. There are so many peptides out there. And ultimately, what do you think the best usages of peptides are when you talk to majority of your patients? What is your thing that you use peptides for? What is the...
So my rationale and how I approach it with patients is it's an opportunity for us to not only mitigate the aging and disease processes that come with aging, but it's when we look at that cellular senescence that occurs and what that does to our body and our ability to then use these peptides to tell the cell that it's going to do something different or to prevent it from going down that diseased path.
Right. How did you get into it? Into it.
Yeah.
To be very candid, it was in many respects, very selfishly motivated. going through menopause and seeing the changes in myself and not feeling great, and really being a little bit disenchanted with allopathic approaches in medicine, and realizing that there had to be something more. Because I joke very often, we're decaying, we're not aging, we're decaying. So we're trying. So we need to mitigate that as best we can.
Yeah.
That is very, very true.
That's so true. We need to have a shirt that says "Stop the decay."
I mean,
Slow the decay.
I mean, that even in aesthetics, our patients always look for things, and they're always like, "Oh, how long is this gonna last?" And my running joke for them is, well, if you stop aging, all of this will last forever. And that's the mentality our patients forget is every single day of our life we are aging, and as you say, the senescence, the oxidation, all of that creating inflammation is all in the process of aging the body, and how much of that is related to the decay or the lack of these peptides and amino acids in our bodies really, really kind of dictates how quickly your curve of aging goes.
Yeah. And that genetic component, and how we can potentially then use things to maybe help our telomeres gain length versus that continuing shortening that we see with aging. So I mean, I think that we probably are just now tapping the surface with regard to what's going to be available to us with peptides in reality.
Interesting.
Awesome.
What are some of the different classifications of peptides? Like, I know there's different types, and how do you kind of put them into different
classifications?
Do you?
You do, because you have neuropeptides. You're going to look at what the target is. So are they going to be hormone signaling? What is the job essentially that they're going to be doing for you? Okay. Separate from the dipeptide or tripeptide or polypeptide component, you want to look at what is it that you need to accomplish for that person. Do you need repair? Do you have somebody that has PTSD and you need something that can work as a neuro signaler? So you want to look at what your ultimate goal is as you're looking for your selections of what will work for your patient. But I do like to give a caveat there, because there are so many cowboys, just like there are in aesthetics, that are utilizing peptides and they don't do testing. And that's a big concern that I think that we need to, look at as we evolve with this as well.
Okay.
Yeah. I was just going to ask, like, how do we test for these? How do you know if someone's low in an aspect of amino acid or peptides? How do you, what are different ways that we can, we have labs that we can order?
We do. So there's one of my favorites is a Dutch Plus, because it looks at, you can pull all hormones through Dutch Plus or ZRT testing, but you get the metabolites. So if somebody, like we can take all the supplements in the world that we want, right? But if our gut isn't healthy, how do we know what we're absorbing? So you can look at things like the indican markers or see what the metabolites are, and you can assess and say, well, we need to probably do a gut reset for you so that your absorption is optimal. So the Dutch Plus, obviously, in addition to serum testing, blood testing, the Dutch Plus and the ZRT testing is probably my favorite.
Wow. Doesn't everybody need a gut reset?
Oh, everybody nowadays. I mean, you have these people with celiac, gluten, SIBO, all
those sensitivities,
that are all out there. And as much as people are taking, microflora and stuff like that, you really don't know where that balance is for your body and what you really need. And I think that's, as you said, there is testing that needs to be done that really is sensitive, because each one of us is individual, and you can see what really needs to be tailored for you. And this is where, as I know you're big onto this, peptides is very individualistic, and I think it comes into, how do you approach a patient as far as like a consultation when they're sitting down with you and saying, hey, I'm interested in peptides? Where do you start? Like, if they said, I want anti-aging, I want I feel my hormones are low. Like, how do you start the conversation, and how do you start the process of consulting with them?
And make a personal custom approach.
Right. So they'll all fill out a pretty extensive, it's almost another version of a health history, but it really deep dives in respect to looking for root causes. So it takes each system, whether it's GU, GI, neuro, it really takes a deep inventory, and it's pretty time consuming for the patient. But you then from there are going to order your labs, do the different testing. And it's really only after that, when you're looking at hormones, I mean, the classic thing with most men is you're looking at their testosterone, their sex hormone, their sex binding hormone globulin, their IGF. You're looking at these different things because one of the complaints for a man as he's aging is loss of libido, loss of strength, lean muscle, the visceral fat. So it's not that they all are similar, but there are similar complaints in age brackets that you look at. But from once you have that testing back, then you're able to make recommendations based upon what you find. I'll tell you an interesting common theme that I'm finding. Most of my fasting blood glucose patients are all above 90. And what's disconcerting about that is a study that was done retrospective from 2008 to 2018, like some 40,000 participants. For every point above 90, there was a 9% increase in risk for diabetes. So what our US laboratories claim are normal, 70 to 99, no, if you're hitting a threshold above 85 as a fasting blood sugar, that's disconcerting. That's something that you want to look at. That's why I am a big believer in the semaglutide and the tirzepatide. So it's an in-depth process that requires a lot of time on the provider's part as well as the patient.
Now, I mean, how do you decide? I guess there's so many out there. I mean, I've been looking into it. I'm like, oh, that sounds good. That sounds good. That sounds good. And, we as providers, let's self-dose ourselves in that sense. And I've yet to really do that because I'm like, I need to learn more about it all. But, I mean, how do you control it? Because the information out there on Google is so expansive. I mean, I know one of the big popular ones in the peptide world is like a BPC 157. People talk about that commonly. I've even had my chiropractor. I'm like, oh, I have my neck pain. And he's like, yeah, just pop some BPC 157 into there twice a week and it'll kind of heal and do things with regards to that. Like, how do you counsel patients with regards to that aspect of it? Because I know we don't want to talk about dosages because that really needs to be tailored in the aspect of it. But in general, kind of, how do you go about categorizing when people have these things? Their friends are on this. I've heard of like TB 500 and CJC and CK.
Well, TB 500 TB 500 is also known. It's also known as TB4. It's amazing, but you're right. You'll have your patients coming in and they'll say, oh, well, Sally is on, this and this and this. The big part here is back in September of 2022 or 2023, the FDA moved so many peptides into this category 2. So unless a compounding pharmacy still had raw materials, they're precluded from making a lot of these peptides that were very popular. Personally, and this is a personal theory here, I think there was a lot of money pull with the FDA there, and that was why that happened. Fortunately, there are some organizations, if you're a member, that you can still get some peptides like cerebrolysine, which is really important for people that have TBIs. So there are ways around some of that, but they've made it difficult for us. But what you have to do, it's really much like what we do with our aesthetic patients. They come in and, well, my girlfriend got more lips or my girlfriend got more cheeks. And we have to say, well, you're not her. And that's not appropriate. So there is definitely a lot of hand holding, I think, more so with my patients that are involved in peptides and the functional medicine. But I think once they start to feel those changes, because that's the other part of this hand holding process, is because this is cell signaling, it's a very slow process. You don't go to bed and the next day wake up and you're like, oh, I'm like Superwoman or Superman. So it's making them recognize you have to just kind of embrace the process, that it's going to be a little bit slower for that feeling to kind of happen, is in a sense.
Wow.
Yeah. I mean, ultimately, do you have a general sense of like in general, what more males need versus more females need, and as far as that, is there a basic type of a thing that you always start people on, just in general kind of a thing, and then you start adding and tailoring from there? I mean, I know bioidentical hormones, I played with it 12, 15
Yeah.
years ago. I stopped
Yeah.
doing it because it does take a lot of hand holding, as you said. You really need to read into the nuances, and it's not just reading a lab, it's really talking to the patient and seeing how they're feeling, because those labs just give you a sense of this is here. And I think this is where medicine has started to fail us, is because there are people that actually probably have subclinical symptoms that probably need to be put on certain things because that's where their range is, and they don't actually fit in the normal, what we consider blood ranges of these things. And so, I mean, can you give a, in general, kind of for practitioners, like what are the general things that you are like, okay, these are decently safe to start with, and start learning about this, and these are things you would start with and then expand upon that and grow from there?
So there are. I without a doubt think that, well, number one, looking at our nutrition, we don't get the same type of sustenance and nutrition in our food sources today that we did previously, right? So our antioxidants, so glutathione, it's a go-to for me. I read a study that around COVID, that was one of the first receptors that the SARS, that the virus was attacking and was depleting in people.
Yep.
So huge to replace that. The other one that I love for men and women, believe it or not, is oxytocin. It is truly amazing. It is anabolic, so it helps. With my patients, my protocol includes a post-workout dose of that. So mood regulating, bone protection, because what are the two things that we really start to get concerned with as we age? Sarcopenia and osteopenia. And then, of course, osteoporosis. So that is a simple intranasal peptide. So people that are needle phobic, super easy to use that. The glutathione is great because that's also intranasal as an option, because the injection can be a little bit uncomfortable. It's like a different percentage, however you want to get it compounded, but it passes the blood-brain barrier.
There's one that actually sprays.
Yes.
There's one that actually is created that's the oral wellness. They actually nanoparticulated it and actually did that. That's a great
Topical.
one.
It stinks,
just
though.
smells a little bit, but hey,
we'll take it.
Rotten eggs or something.
Yeah. But I would definitely say we are seeing and it's pretty phenomenal. Just like we're seeing cancer starting in younger and younger populations of people, we're also seeing hormonal disruption in younger women. And so I would have to say that I focus on balancing hormone. If I need to get women and men on testosterone, I do sub-Q injections. I've been big, with the research on that and the studies, that it's actually a better delivery doing it sub-Q. And then I would have to say my secretagogues, my analogs, whether I go with tesamorelin or sermorelin, I really love those because we're all losing that lean muscle as we're getting older. Yes. And that's so important to try to preserve. Yeah.
Yeah.
Now, when you're doing these peptides, when you're starting somebody on it, are there some side effects that they should look for when they're taking some of these?
So the most common, I would say, with your intranasal is just a little bit of, inhalation irritation initially, but that really dissipates. And the biggest complaint is going to be injection site reactions, for sure. And even though I teach my patients to use a nano needle with their subcutaneous testosterone, I'll still, it's mostly the guys that'll reach out.
I'll admit we're wimps.
and they'll say, oh, that's really uncomfortable, or I'm a little red. Is that normal? So that would be that's obviously the most common. But with your secretagogues, you still want to get be concerned about or communicate with them. Hey, if we need to pull back dosing if you start to have joint soreness, or if you start to have issues that you would have associated with excessive growth hormone. But that's so rare because we microdose that. So, but those are just things that you do communicate with them and talk to them about so that they're aware.
And is there a point where someone is on peptides for a while and the receptor sites get fatigued, or the receptor sites, I can see where it might not work as well? Like, do they ever need a rest from this?
Yes. Peptide holidays are essential. You have to do that because it's diminishing return. like to what end? So you want to give those receptors an opportunity to kind of take a break, if you will, and kind of have a reset. And then, you'll get patients, I'm so worried that I'm going to lose this progress that I made. If you've had a comprehensive change in lifestyle, which is the whole goal of this as well, it's the whole diet inventory, no seed oils, you're going through this whole list with patients, then conceivably taking 45 to 90 days off of something is not going to set them back to square one.
Okay.
Interesting. So some of the questions we say, while every patient is different, are you finding common deficiencies in general for men and women? Are there common ones that you're starting to see more of recently? I mean,
I would say yes, but it goes hand in hand with the age-related changes. So I still will worry about sarcopenia and osteopenia with men and women, much the same. And I would say that what I worry about with men more is visceral fat. I have a great concern when I get men that are just, when I do my in-body scans on them when they're very high. And that's obviously a greater risk for cardiovascular events. But we're also seeing a lot of that weight there with women as well. So I really have to say there's a lot of parallel.
Interesting. Another question, how Section 503A and 503 of FDA affects your practice? Are we allowed to use MOTS-C, melatonin, CJC 1295, ipamorelin, all the things.
Yeah. So MOTS-C, it really is a shame because that was such an amazing peptide for mitochondrial health, but that was a part of that move. But fortunately, we have things like methylene blue. We do have other things for mitochondrial health. Melanotan, I was never a huge fan of because of the risk of renal infarction. So, I think maybe in a year I would write 2 prescriptions for that. So I was not sad to see that go. But with CJC 1295 and ipamorelin, we have tesamorelin and sermorelin. So I don't really feel like I've had a loss, And in the studies that were done for tesamorelin, granted it was the HIV population, but it was incredible for that visceral fat reduction for patients with HIV. So I'm a huge fan of tesamorelin as I am with sermorelin.
Interesting. Yeah, which is growth hormone.
The secretagogues, yes. Growth, they go right to those receptors and stimulate that pituitary to release a little growth hormone.
So, one of the things out there that I know people are going to ask about is, and maybe you can address it, you're going to get your patients, you're like, oh, I can get peptides on the marketplace.
Alibaba.
What are your thoughts on that? Because, there was here, even in California, where we couldn't get semaglutide, even through a compounding, our California pharmacy restricted.
They won't allow it anymore.
The compounding pharmacies to send it here to California, and even the pharmacies here in California couldn't make it. And it was more that they would strong arm them because of their clean injection thing. So if you didn't get that certificate, you couldn't make any other clean injection stuff. And so it was like the way that they controlled them in a sense. It was all about power control. And so, some of my friends actually ended up going into the research routes of those peptides and stuff like that. Thoughts on that? Those are
it honestly
it opens a big
it petrifies
big doors
me because peptides are mass produced in China. And only in the US are we 98% pure. And so that process with that compounding pharmacy to remove those endotoxins, that's the safety of our compounding pharmacies that are regulated here in our country. So these patients that are ordering, and I think I even sent a screenshot of one to Lori that I'd recently found, order your bundle today. And it includes things like melanotan and these different peptides that have been moved into this category too. And I guess it's the same thing that we saw with aesthetics, people injecting themselves, people going into, it's no different than going into someone's home and having them do an unknown substance into your gluteus. You can't wrap your head around it, but it's going on. And
Right.
that is really terrifying to me, because you cannot undo that damage that you're potentially doing. You really can't.
Good.
Bill Gale is asking a question that he's used cerebrolysin. I came in cerebrolysin. IV. Is there another way to administer it besides IV for injecting it for people with memory issues?
So I'm assuming that he means that he did it like as an injection, not IV, because I'm not familiar with it as an IV. But there is intranasal spray for that as well. And that, unfortunately, that like I had to become a member and pay a fee with a special worldwide peptide entity so that I could still get it, because that was moved into that category 2, group. But there are other peptides available for memory and cognition, and that's also where I encourage patients to look at supplements like alpha GPC, which is amazing for cognitive function and memory. And that's a simple, under the tongue
alpha
dropper.
GPC. I'm writing that down.
I'll send it to you, because one of the things I hate having patients on Adderall. I really don't like, especially women. I'm like, those beta receptors, it's just not a great, it's a drug, it's a stimulant. So if I can, put them onto something like alpha GPC or something that's going to help with that cognition and that memory and that focus and whatnot, I would obviously much rather do it that way.
Wow. I'll be calling you.
So, I mean, ultimately, you have a wide breadth of knowledge with regards to peptides. Those of us that want to get started into this, where do you start the process of learning? Because there's a lot of literature out there. You can do your own things, but I mean, I think there needs to be a guidance, and maybe kind of you could say like a little bit of a SOP in the beginning, and then as you start to get your experiences as in aesthetics, then you start to play around and mix and match and stuff like that. Anything that you've encountered that you feel are great educational resources for you that you really, really respect? Because there's, we all know there's a lot of education out there, and there's a lot of good ones, and there's a lot of bad ones out there. And just to kind of delineate it for our.
So I am in the process of doing a fellowship under A4M in anti-aging and metabolic medicine, which really obviously deals with that functional medicine approach, and obviously deals with a big part of peptides, and they hold conferences all the time. One of the other pioneers is William Seeds, who is an orthopedic surgeon, and he has started an institute, because some of his papers are really fascinating, because he's brought people back from deep, the progress of ALS and what happens to people, and he's helped them regain motor function. So it's pretty incredible through the use of peptides. So he's another one. He has a lot of books. So it doesn't even mean that somebody that's interested in it has to sign up for one of his conferences. You can just get some of his texts that he's written, and he really goes into that whole process and the evolution of peptides and what they can and can't do. So it can be a very simple start just with getting some text, but there are definitely some great organizations out there for people.
Yeah, A4M's been around for a while, and I think it's gaining a lot more popularity because everybody in the aesthetic world is kind of going, whoa, there's a regenerative part. Like rather than fix the saran wrap, we want to fix what's in it, so we want to kind of work. It works hand in hand with what we do in our aesthetic practices. Yeah. So why not help the inside be better? It's going to help the outside be even better. So it makes total sense. So yeah, A4M, I think it's, you've gone a few times to that. And I think it's one of those meetings that it's gaining popularity, and it's getting bigger and bigger, but for good reason. For good reason. There's so many things we didn't know before that we're learning now.
Anything out there that you would say don't go to? the little pitfalls that you've that wasn't probably the best. I know you don't like call out, but I mean,
no. Well, I think the thing that we're noticing more and more, and my husband and I have talked about it, is it's like everybody has a conference now. So I think it's just really investing in the quality, and that has been around a while. Like you said, A4M has been around a while. And find those pioneers, really, like Dr. Seeds, like the guys over at A4M. Find those people that are really the pioneers in this, and the research behind it, and then, kind of root yourself in there. I think that the everybody having a conference, I mean, literally every weekend, there's an aesthetic thing going on, and you're kind of like, wait, what? It's so that part is, it's challenging, it's not, this mentorship that you have through AI is so deeply rooted in like the layers, the foundation, and how you do it. And that really is the approach that should be happening in the regenerative medicine part too, right? You have to learn the fundamentals of the endocrine and the GI and the neuro and all of those components that you can then, oh, well, that could affect this or this could affect that. And you kind of put the pieces together.
Yeah.
Yeah, absolutely. It's like, if you don't know the why, if you don't know the cause, don't go putting a Band-Aid on something.
Yeah.
You can really mess things up if you don't understand the root cause of a lot of these issues. And I think that's, Kristen, I think that's so important in anything we do, anything in medicine.
And I think
stop with the Band-Aids.
Yes, because it's not a band, and the Band-Aid could make it worse. I think the other thing too is recognizing, this in the evolution of medicine. And I always frame it back to this very memorable interaction I had with this endocrinologist who was about 70 years old, many years ago. And I had a woman who was presenting with what I was terming idiopathic hypothyroid, all the classic symptoms. Her TSH was somewhere around 3.8 something. So in theory, normal, not needing to be treated. But looking at her reverse T3 and looking at her free T3, I thought, she's symptomatic and she's miserable. Let's give her a little bit of Armour thyroid, so she's getting a little T3 and a little T4, and make her feel better. We can do low dose. We'll go 7.5 milligrams, something very small. But he said, no, that's just a woman thing. Like, in other words, it's the menopause. It's that very old school mentality of thinking. And that's where I feel like with this regenerative component, and then you couple that with aesthetics, what we do topically, I think it gives us a great marriage, because you make people feel good on the inside and then they feel good on the outside. That's why I think they need to be together.
Yeah, for sure.
Question about where you get the cerebrolysine nasal spray.
So he's going to have to find a provider that is in this membership program that is still able to get it. It's like I said, it's a paid membership. So he could probably go to the International Peptide Society and find a provider in his area that's in that group, and they could hopefully prescribe that for him. Excellent.
Okay.
Excellent.
Any good ones for hair restoration?
Huh?
Oh, of course there are. GHKCU is like one of my favorites. Let's load them up on that. But also tell the person that asked about the cerebrolysin to look into a peptide called VIP. It's a gut-brain axis, but it's VIP. It's vasoactive intestinal peptide, but it is really good for the brain as well. It's a gut-brain axis peptide, but it's very good for the brain. But GHKCU, I really love it. You're finding some pharmacies not making it anymore for injectable, but they are using it for topical. It is probably one of the best genome stabilizing peptides that there is as far as powerhouse for antioxidant activity, but it is great for hair restoration. Microneedle it in. If you can find a compounder that still had the raw materials to make it as an injectable, there's a protocol that you can do for anti-aging or just for a cellular reset. So there's so many variations of things that you can use GHK for.
Wow, that's interesting.
It's in this world of peptides is just enormous. Enormous.
It is.
What about, we had a question earlier, I don't see it now, but what about anything that's anti-neoplastic, anything that helps with any cancer mitigation, anything?
So there is PNC is considered an anti-cancer peptide, but that is something that I strongly in our domain, in my domain, I would not feel comfortable working with somebody that was dealing with an active form of cancer unless it was in unison with their oncologist, because you want to make sure that what you do for, antioxidant support 100%. But starting to throw anti-cancer peptides at patients when you don't know the genetic makeup of that. Did they do the marker testing? What did they find? You've got to do a lot of caution with that, because that would be, like you said earlier, that analogy of putting that Band-Aid on something.
Yeah.
Right. Now, are some of are majority of these peptides like once a week, or are they like every day? Like, because I'm counting up all the things that are out there, and you're like,
all your injections.
Go
So your secretagogues, or your analogs like tesamorelin and sermorelin, those are going to be nightly, and you typically do like a 5 to 6 night a week, and you have to be very specific. It's postprandial by 2 hours. You need to have an empty stomach, but you're mimicking kind of when your pituitary would be releasing that growth hormone, which is at night, and it really does help the sleep and all of that. But your GLP-1s, your dual agonists, the GIP, GLP, those are once a week. But typically you do cycle. So like if using, for example, NAD, which is a coenzyme, if they're going to do a course of NAD, they're going to cycle that. So they're going to do that for maybe 6 to 8 weeks, then they take a break. And it just depends on what you're trying to accomplish for the patient. Like if I'm trying to help a female do some neural reset, they may do, NAD in the morning for a period of time. It just really depends on what you're trying to accomplish for the patient. But yeah, you're not always doing them every day.
Okay. I mean, as I hear all of these, and as some of the things I read, I'm like, wow, that one's good. That one's good. That one's good.
Like,
I want them all.
Yes.
And it seems like I'm going to be
anywhere you can pinch an inch, you're good. Anywhere you can,
you're like just inject everywhere.
I'm just going to be a pincushion.
My favorite
every day.
Needles.
Yes.
Also the intranasals. I hate needles. Yeah.
Yes.
Gee, how interesting. So when you give someone a break, say they're on this for a few months, whatever it is, and then how long of a break do they need to kind of help those receptor sites kind of reset so that they're able to accept the peptides next?
My minimum is going to be about 45 days. 45 days, I'm going to want them to take a break. And it's about that time frame that you'll start to get the pinging from them, like, oh, I'm like feeling like I'm running out of gas. You'll start to get those texts that they're feeling like they need a little something. So I don't have them stop their BHRT if they're on that, but it's specifically the peptides. They'll take that holiday, and they'll just. Do I think that some of it is psychosomatic? Yes, I do, because I'm pretty certain if I ran that extent, I mean, the testing's pretty expensive, but I'm sure if I had run testing on them again, I wouldn't see a change, for the worse, but they'll start to feel I'm not sleeping as well, because those secretagogues, I do have to attest, they really help with sleep, and that's one of the things that seems to escape women as we get older, is that ability to get really deep restful sleep.
We're so lucky.
I know.
I don't have that issue.
You're a guy.
I know.
Yeah.
Question on just like, there's so many and there's all these tests. On average, what does a patient end up, or what does a practitioner end up charging? Because that'd be an important thing to just, where's the budget on this? Because then you throw in the aesthetics and your budget just keeps getting bigger and bigger and bigger. What in your thing is like the average patient's spend on the initial testing? What do you charge? And then, on average, what are patients spending with their peptides, their combination that you end up deciding? Is there
like monthly, I guess, probably like what is it monthly
type of a thing?
Average?
So most of your initial consults are going to run in the $250 to $350 range, just for that consult, that intake. I was pretty fortunate to negotiate cash pricing for labs, because a lot of the insurance companies don't cover an RBC mag or a adiponectin. They're going to push back. So a cash price of about $400 for this huge amount of testing is pretty darn good.
That's great.
It is, yeah. The Dutch Plus can run up to about $400 as well. And then I like to do that telomere testing and look at some of their genetic markers, and that's about a $700 investment. So, I mean, it is pricey budgeting. And then the peptides, the secretagogues, are the most expensive. Those can run anywhere, depending upon how often and what kind of dosing they're on. A guy in particular could look to be spending somewhere between $600 to $1,200 every 10 weeks or so. It just depends on their dosing. The dual agonist tirzepatide, and then tirzepatide's a little more expensive because it is a dual agonist, and then your semaglutide it's all about the quality of the pharmacy. I don't push back at my pharmacists and try to get cheaper pricing, because I understand what it takes to get that sterility testing and make those peptides are so delicate. They can degrade very easily. So I have a lot of respect for what they do.
How do you evaluate the pharmacies, compounding pharmacies?
So you can actually go to our FDA website. Maybe the one thing they're good for. No, I'm just kidding. Look at their any kind of dings that these pharmacies may have received, because they are very, very quick to go into those compounding pharmacies for inspections, and all those reports are public record. So you just go on there and do a deep dive on that compounding pharmacy and find out what kind of integrity they have, honestly.
Interesting.
Now, Kristen, we have a question. What are some good sources to learn more about peptides, which you mentioned, the books and the APRN, the conferences. Yeah. And do you offer private training?
Yeah.
I did before COVID, but I just haven't really picked any of that stuff back up because I've been, my very, very loyal patients keep me very busy. So I feel blessed. But yeah, I mean, at some point I would like to do a mentorship because I think that's more meaningful versus, larger group training. Because there's such a process that goes with this. I see what you both put into what you do, and I'm, mind blown. So I do, but it's gonna be more one-on-one.
Good. And again, Kristen is at Elite Medical in Tampa. So just so you know. And on Instagram, what's your Instagram?
Oh, Lori, I've had it. I should change it. It's Skin Guru One. Literally,
Skin Guru?
Like 900 years. No, Skin Guru One. Yes, Skin Guru One.
Skin Guru One. So yeah, so that's Instagram. So you can always DM or whatever.
Yes.
Send you lots of messages about it. So
awesome. Well, any last minute things for the practitioners out there on peptides? From your standpoint, words of wisdom.
Just take the time to really get to know them and, read furiously. Don't take studies that are out there. I mean, this recent one really quick that came out about semaglutide had me pulling my hair out because I was like, it was an observational
study of like, maybe this is connected, yes. Maybe it's not.
Maybe it's not. And
look, everyone who's diabetic has a long toenail. Yes. It's connected, right? Yeah.
So that kind of made me want to pull my hair out. But I would just say that don't believe everything you read, and have a good resource or mentorship, kind of like what you all do, where you're able to go to somebody and troubleshoot. Because I do that. I have a couple of colleagues that I turn to. Hey, what do you think of this? This is a weird presentation, or I'd like to try this for my patient. Especially the autoimmune type patients that you want to try to help get through things. So it's a rewarding part of this, and it's such a new horizon for us. But I think it's the perfect marriage between the aesthetics and then the regenerative. So it's worth it.
It is such a great synergistic addition to medical aesthetics, because we are trying to help people look like they did a few years ago and keeping their subtle nuances. Right. So we're trying to help them kind of look better. But what is better than helping on the inside? In fact, there's something, Kristen, have you heard of Time Plus by Nuchido?
No.
It's a supplement that actually I provide to our patients. That it's a supplement like a vitamin, but it actually helps to increase NAD by about 240%, and extend the telomeres. And it's just a supplement. So it's something I add into my Sculptra treatments, any of the biostimulator treatments, microneedlings, silforms. Any time we're doing something, lasers that will stimulate collagen and help that collagen grow, I want to add in there something from the inside that will help that work and help that treatment work even better. So the peptides are like way beyond that, but just anything that's going to help with this, to help with the anti-aging, to help elongate those telomeres, to help increase that NAD, to help with a lot of the issues that are going on with the crappy food we eat nowadays. with everything, with all the things that are, who knows if we're eating real food or not. But it's a lot of these things that are happening that we aren't aware of, that we can become more aware of and help, in the long run.
1000%.
Thank you so much, Kristen. We'll have to bring you back out. Maybe you can do a whole little series about him, about the basic ones.
And we'll bring 400 injections just for you, Gideon.
Yeah. I'm ready.
So find Kristen, Skin Guru One, Kristen Hanenian, Tampa, Florida, Elite Medical. So if you want to DM or whatever, ask her more questions. Your inbox is going to be really full tomorrow.
Thank you guys so much for having me.
Thank you so much for taking the time out.
Love you, girl. Thank you
so much. Talk to you soon. Love you too.
Quick. Her husband has a podcast that's phenomenal. Keith Hanenian. It's Pro to Pro podcast. I was lucky enough to be asked to be on it, and it was phenomenal. So if you guys go onto YouTube, you'll find Pro to Pro podcast, and a lot of really, really good information on there regarding professionals, and kind of a lot of really good business stuff also on there. So
awesome. All right, guys. Thank you for joining us at this AI Live. We will be doing our next one August 6th. And it'll be at 5 p.m. again. And we're going to be talking with Dr. Sadat, talking about anatomy, cadavers, and from his point of view as a plastic surgeon. So join us on August 6th at 5 p.m. for the next AI Live. Until then, thanks guys for joining us.